Are medical death panels coming to America? Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. In the original Obamacare bill was a provision for what was dubbed a death panel for Medicare. The Independent Payment Advisory Board, IPAB, would evaluate the cost-effectiveness of new and existing drugs and treatments. Rather than ration health care directly, the panel would achieve the same goal by recommending slashing reimbursement payments. After fierce opposition, the board was kiboshed, but the unstated premise of the idea was that we were spending too much keeping patients alive for only a short period of time, or prolonging people's lives that were of low quality because of pain and discomfort. Unfortunately, the spirit of that would-be death panel is alive and well in other countries, and is being pushed by many medical professionals and observers in this country to save money. Euthanasia is expanding in Belgium, Holland, Canada, and other countries. The hushed-up scandal is that patients have been killed without their consent. Even more shocking is that children have become victims of this medical cult of death. It's one thing if a person of sound mind and body makes known in writing his or her wishes about when so-called heroic measures are not to be taken, but quite another when a patient is put to death. It's also a whole other matter when people are denied care because government health care bureaucrats decide that the quality of a person's remaining life doesn't justify the expense of enabling that person to live longer. Many countries with government-run healthcare systems have taken to assigning a monetary value to a person's remaining life. The metric is dubbed Quality-Adjusted Life Years, QALYS, QALYs. If the cost of treatment exceeds this value, the patient won't get it. In Britain, for example, the National Institute for Health and Care Excellence, with its Orwellian acronym of NICE, does what many other patients do. A patient is out of luck if a drug or treatment is deemed too expensive. This can be deadly news to the elderly with chronic conditions or people who suffer serious disabilities. Most Americans rightly recoil at such a system, but let them die advocates are becoming more forceful. To prevent this anti-patient mania from overtaking the U.S., Representative Kathy McMorris Rogers has proposed a bill called the Protecting Healthcare for All Patients Act that would prohibit Medicaid, Medicare Part D, Medicare Advantage plans, and the federal Children's Health Insurance Program from using QALYs to measure the cost-effectiveness of drugs and treatments based on how much it would extend a patient's life or improve that person's quality of life. The legislation should be immediately enacted. Healthcare expert Sally Pipes aptly sums up the situation. Quote, "QALYs are a pseudoscientific and inhumane way to make decisions about medical treatment. In countries where regulators rely on these metrics to determine patient access to drugs, they almost exclusively lead to denial of life-saving treatments. Keeping QALYs out of the U.S. will save lives." End quote. I'm Steve Forbes. Thanks for listening. Do send in your comments and suggestions. I look forward to being with you soon again.